Hello, my name is Duncan and I am with Community Hospice Medical Equipment Division. Today we will be discussing the suction machine and the benefits it provides our patients and caregivers. We will share with you how to safely set up, use, and troubleshoot common issues. The purpose of the suction machine is to assist patients who have difficulty swallowing by removing secretions from their mouth. When you receive your suction setup, it will include the machine, the canisters to hold the secretions, lids to the canister, connection tubing, and oral yonk hours to help with the removal of the secretions from the mouth. When your medical equipment technician comes to set up your suction machine, they will start off by assembling the canister and lid. The lid has 4 ports, 2 which will be capped off, one port that will connect the machine to the canister, and the last port to connect the tubing to the yonk hour. On the other side of the canister lid, we will have a safety filter used to prevent secretions from backing up into the machine. Once you've gone over these, you will then place and securely push down the lid onto the canister. When the medical equipment technician has completed the setup of the canister, they will take the canister and place it into the holding pin of the machine. Then they will take the short tubing, connect it to the port designated vacuum, and plug it into the machine. Following that, then they will find the last port that's open that says patient and connect the long tubing to that port. You will then plug in the suction machine to a power source, obtain a glass of tap water to test the suction of the machine, take the long tubing, place it in the glass of water, locate the power source on the machine, and then turn the machine on. If you connected the machine correctly, you will notice the water leave the glass, follow the tubing, and end up into the canister. When you have verified that you have connected the machine correctly, you will then take the long tubing and connect it to the suction device known as the yonk hour. To clean your machine, you will first start off with the yonk hour and the long tubing. You'll obtain a warm glass of water, place the yonk hour into the warm glass of water, turn on your machine, and let it run all the way through, emptying the glass of water. This will help to clear out any debris that may still be stuck in the yonk hour or the long tubing. Following that, you will then disconnect the short and long tubing from the canister, remove the canister from the suction machine, remove the lid from the canister, then empty its contents in a sink or toilet. Common troubleshooting issues include decreased suction to the patient. First, start off with the canister lid. Located underneath the lid is a canister filter. This filter does prevent any backup into the machine, so you want to observe whether or not the filter has become wet. If it is wet, it will prevent any suction from going into the machine. If that's the case, obtain a new lid. Secure it back to the top of the canister, plug the ports, and turn the machine back on to see if the suction is returned. Lastly, you will check the suction machine filter. If for any reason you notice any discoloration or moisture buildup in the filter, you will contact Community Hospice Medical Equipment Division and they will bring you a new filter. For additional information or questions, please contact Community Hospice Medical Equipment Division.